Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Pseudomonas aeruginosa under the section of infectious diseases. This is a picture of Pseudomonas aeruginosa, which, as you recall, we previously mentioned that it's not common practice for the MRCP exam to give you these sort of slides. However, the college is very much within its right to give you the slides, especially as part of the Part 2 written examination. Therefore, our recommendation is that you have a broad understanding of what these different bacteria may look like under the microscope, so you can have at least an educated guess if it was to come on your test day. The epidemiology of Pseudomonas aeruginosa is that it is relatively a common hospital-acquired infection. The risk factors include prolonged hospital stay, antibiotic use, neutropenia, burns, chronic suppurative lung disease such as bronchiectasis, and diabetes. The pathophysiology of Pseudomonas aeruginosa is that it is a gram-negative, rod-shaped, opportunistic bacterium. It ubiquates in soil and water. It has a pili, a flagella, and a polysaccharide capsule that aid with colonization and infection. It can form biofilms, and multiple inherent and acquired mechanism of resistance can potentially be formed as a result of Pseudomonas infection. And in those cases, it is actually quite difficult to treat. The clinical manifestation is that it depends on which organ system it has affected. Very commonly, it can affect the pulmonary system, such as in patients with bronchiectasis or cystic fibrosis, and it could present as a case of acute pneumonia in hospitalized patients. If it has infected the skin and soft tissue, it is associated with burn wounds as well as surgical site infections and folliculitis. It could cause malignant otitis externa as well as meningitis and infections of the bone and joint disease such as endocarditis and osteomyelitis in rare but severe complications. The management of this is with the use of antibiotics, especially aminoglycosides such as ceftazidime or carbapenem, or fluoroquinolones and penicillins such as piperacillin. Dual therapy is recommended in the cases of neutropenic populations, and biofilm adds to challenge of treating this type of bacteria. Resistance to disinfectants also is present, which could potentially add further challenge in thoroughly treating this bacteria. Let's do some questions. A 60-year-old man with a history of COPD is hospitalized with a respiratory infection. His sputum culture grows Pseudomonas aeruginosa. Which factor makes treating infections caused by Pseudomonas aeruginosa particularly challenging? A. The rapid onset of symptoms following infection. B. Its ability to survive in an anaerobic environment. C. The production of a protective biofilm. D. Its rapid rate of replication. E. The tendency to cause asymptomatic infection. If you were paying attention during the session, you will realize that the correct option in here would be option C, which is the production of the biofilm that gives us this particular unique feature to make the treatment of Pseudomonas infection particularly challenging. Thanks for listening to this episode of Bite-Sized MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.